Alright, hi guys, a very good evening to all of you. Welcome to this part 2 of INI-CET series, and I'm extremely sorry for this short delay because of some technical issues that we were facing actually. And before I start this session, just let me know if I'm clearly audible and visible to all of you, all the students those who are live right now. Please let me know. There were some technical issues, that is why I'm around 5 minutes late, so I hope that is not going to trouble. We will try to extend the session if it is required. All the students those who are live right now, I'm just using another system here to get in touch with you, to read your comments and messages. Please let me know if I'm clearly audible and visible to all of you. Alright, I hope things are fine now and we can start our session already. Okay, Dr. Shantan Vasu, welcome. So in part 1 already we have discussed, as I told you, that we have discussed more than around 18 to 20 drugs already. And as I said, you don't have to know all the newer drugs, because from the newer drugs not a lot of questions are actually asked, but few important ones that are must know, which INI-CET is usually very fond of asking the question that we will be discussing. So whatever we have discussed in part 1, so this series is having part 1 already. So that part 1 was conducted 2 to 3 days ago. That is already there below this video, you can find it out. Now today we will be discussing the part 2. We will find out from where we left yesterday in the part 1, and then we will be starting from that point. From that point only we will be starting. Okay. We discussed few of the point. Okay, so in the part 1 we already discussed remdesivir is already one of the topic that is discussed, that happens to be RNA dependent RNA polymerase inhibitor. This I have already told you guys in the part 1 series already. Remdesivir, RNA dependent RNA polymerase inhibitor, right? Safinamide also, I think I have told you that it's a newer drug that is acting by the MAO-B inhibitor, right? Safinamide is a MAO-B inhibitor. So these all we have done already in the part 1. Okay, part 1. Now we will be starting in part 2. I hope everything is absolutely fine and we can start our today's session already. Okay. Okay, so the new question that we are having is, the new drug Nicorandil is started to a patient with angina. True about this agent. Nicorandil, remember? Okay, it's a new drug for the angina. So one thing that is very sure, that Nicorandil is for angina. It's a drug acting on the dil, right? Nicorandil. True about this agent. It's a nitrate ester that can cause vasodilatation. It is a potassium channel blocker. It activates sodium calcium exchanger A and C both. So you can provide your answer in A, B, C, D in either of these, and I will be looking for your options in the comment section here, and accordingly we will be doing our discussion. Please provide your answer, guys. Please provide your answer in this. Okay. Dr. Shantan Masu is in favor of D. Okay, so a while ago I was live also on the Unacademy special platform, and that there was a question also that was asked on Nicorandil. So you see multiple examination that are being conducted, they are asking continuously about Nicorandil. That means there is something important about Nicorandil that you should know. It's one of the potassium channel opener. Yes, it's not a potassium channel blocker. The term that has been given here is a potassium channel blocker. Remember, it's not a blocker, it's a potassium channel opener actually. Okay, it's actually a potassium channel opener. Okay, it activates sodium calcium exchanger. Yes, therefore they will reduce the intracellular calcium, right? Therefore the tone itself will be reduced if the intracellular calcium will be reduced. Okay, then if the potassium channel will be opened, then once again there will be repolarization followed by hyperpolarization, and definitely vasodilatation that can be caused because of the, right, nitric oxide, right? So it's a nitrate ester that increases the nitric oxide. It is going to increase the nitric oxide, right? So correct answer that you have got, guys, all of you, that A and C. Please do remember this. Nicorandil is not only potassium channel opener. I repeat again, it's not only a potassium channel opener, it is having other mechanism of action like increasing nitric oxide. Please do remember. Then opening the potassium channel, right? Sodium calcium exchanger, right? Sodium calcium exchanger. Three important mechanism of action, remember. And the use that we have told you, use, it is mainly an approved drug for the angina, right? Nicorandil, approved drug for the angina. Okay, I hope it is clear to all of you, and we can proceed to the next question now. Okay, so likewise, Nicorandil, there is another drug, that is Ranolazine. Ranolazine is an approved drug for angina. It acts by. So this is not a very recent drug. Okay, Ranolazine is running in the market for quite some time, and in fact, your books that has been released in launched in around in year 2016-17, they all contain this information about Ranolazine. So please provide your information about Ranolazine. It acts by fatty acid synthesis inhibitor, sodium potassium ATPase inhibitor, late sodium current entry inhibitor, funny current blockers. Okay, all the students those who are live right now, please provide your answer of this question, and then accordingly we can do the discussion. Ranolazine. So I have told you one drug, Nicorandil. Now I am telling you Ranolazine. That is also one of the drugs that is approved for the angina. Okay. So Dr. Tarun Bhatia is in favor of A, that is fatty acid synthesis inhibitor. Very good, doctor. Other students also, every one of you, please try taking participate. Try to participate. So if ever you are getting correct, that is well and good, bravo. But if ever you are getting wrong, you will be learning definitely from this mistake, right? All the students, please go ahead. Okay, Dr. Harika is in favor of C. Okay, very good. Dr. Pabbo Ju, they are in favor of C as well, late sodium current entry inhibitor. Okay, so in the angina, remember, angina, that is one of the tissue that is undergoing, right, hypoxic injury, the tissue that is undergoing hypoxic injury, right? Ranolazine is one such drug, remember, it is one of the fatty acid oxidation inhibitor, right? Fatty acid oxidation inhibitor. It's not a synthesis inhibitor, okay? Fatty acid synthesis inhibitor. So fatty acid oxidation inhibitor drug that we are having, that is another drug you should know, trimetazidine. You should know the name of the drug, that is your trimetazidine, and other drug that we are having is Ranolazine. One more point that you should know, that according to the recent evidence that has been published, that although trimetazidine, they say that's one of the fatty acid oxidation, you can remember like this: if you want to burn your fat, fatty acid oxidation, no, so if you want to burn your fat, I would say try running. Trimetazidine and Ranolazine, you will remember in the examination like this: if you want to burn your fat, try running. Okay, so trimetazidine and Ranolazine. Now according to the recent evidence, what they are saying, Ranolazine, main mechanism of action that we have, main mechanism of action of Ranolazine is late sodium influx inhibitor, right? Late sodium influx inhibitor. Okay, that is the main mechanism of action of the Ranolazine. So correct answer that we are having for Ranolazine is C is the correct answer. It's not a funny current blocker. Remember, what is the funny current blocker? I am sure all of you guys are aware about funny current blocker, that is your Edaravone. Edaravone is considered as one of the funny current blocker. Okay, not a sodium potassium ATPase inhibitor. Sodium potassium ATPase inhibitor is used in heart failure. The name of such drug is your digoxin, right? I am sure all of you guys are very well aware about that. Okay, so by blocking the late sodium influx, what will happen? There is, right, there is no, or there is, you can say, decreased amount of, there is no activation of NCX, sodium calcium exchanger. There is no activation of sodium calcium exchanger. That is very, very important, because whenever there is intracellular sodium, like for example, let me just tell you, give me 1 minute, let me just tell you, this is one of the cardiac myocyte that is undergoing hypoxic injury, right? Angina wala ek tissue hai, right? Now they are saying that there is an activation of a late sodium current, late sodium channel. What will happen through this channel, guys? Through this late sodium channel, actually there is an influx of sodium. Remember guys, intracellular sodium is never physiological. Intracellular sodium is never physiological. Therefore what they do, they will be actually causing the activation of the NCX. NCX activation karke, they will start pumping out sodium. This is the next step. Once the intracellular sodium is increased, then this NCX will be activated, right? That is going to pump out sodium at the cost of calcium. Now remember, intracellular calcium, it is going to increase the tone. So even during the diastole, the heart will be into the diastolic stress, right? So what we have, intracellular calcium, when it is increased, then there is a diastolic stress in the cardiac wall, right? So diastolic stress. During the diastolic stress, the heart again won't be able to receive the oxygen. When the tone is high, because during the diastole only the cardiac muscle is supposed to receive the oxygen, right? So when the tone is high, when the stress is high, this cardiac myocyte won't be receiving the oxygen, and once again what will happen? This cycle of this hypoxic injury will continue. When calcium increase, no oxygen, the injury increase. Therefore, if you block this, very simple, if you simply block this one, if you simply block this, then none of this sodium calcium exchanger will be NCX will not be activated, and therefore no diastolic stress, right? So they also, by no activation of NCX, and there is, right, they inhibit the diastolic stress. I hope all of you guys understood this concept of diastolic stress. Very commonly asked, and remember this is a very fine point which INI-CET can ask you and 18.5. Okay, late sodium current entry inhibitor. Okay, C is the correct answer. Moving on to the next one. The approved drug Nicorandil, the spelling is actually E, Nicorandil, right? It is used in which of the following condition? I think this was a question also in your recent GT as well. Same question was also asked in your recent GT. I hope all of you guys can get it. Please provide the correct answer for this question. The approved drug Nicorandil, it is used in which of the following? Option A, angina, arrhythmia, glaucoma, or cataract. In which of the following condition you can use? Not a very not difficult one. Definitely it's an easy one, right? So Nicorandil, Dr. Shantan Basu is in favor of C. Dr. Tarun Bhatia is in favor of A. Other students, please, right? Okay. Now I'll just try to save some time here because we have to discuss some question and the time is really lesser. So what we have here, remember, there is a Rho kinase inhibitor that is acting on the heart, right? A Rho kinase inhibitor that is acting on the heart, that is your Fasudil. Okay, Fasudil, right? So I have told you how to remember. Fasudil sounds like फंसा हुआ दिल और फंसा हुआ दिल रोता रहता है. So that is a Rho kinase inhibitor. So Rho kinase itself is a vasoconstrictor, but when you inhibit it, there will be apparent vasodilatation, right? There will be apparent vasodilatation. Now Nicorandil, remember the term is coming. Nicorandil sounds like netra. Netra means eye, right? Nicorandil in Hindi term that is coming here is netra, and meaning of netra is eye. So that is acting in the eye mainly for the glaucoma. Nicorandil is an approved drug for the glaucoma. Remember, it is used mainly with the, right? Used mainly with your, right, PGF2 alpha analog like your latanoprost. So along with latanoprost, they are not given alone, but along with latanoprost, yes, they can be used for the management of the glaucoma. So there is one Rho kinase inhibitor Fasudil that can be used in the angina as well. So this is an approved drug for the angina, agreed, but not Nicorandil. Okay, Fasudil is yes, but not Nicorandil. Okay, I hope it is clear to all of you that it is a glaucoma. That is the correct answer. Okay. Okay. Edaravone is a recently approved agent that is used for Edaravone. So this Edaravone question has already asked by AIMS in 2018, I guess. 18 November May already Edaravone has been asked. So if you have been a continuous follower of the AIMS question, definitely you will be able to mark this correctly. Okay. Edaravone. Please provide correct answer, whether it is for the multiple sclerosis, whether it is for the Wilson disease, whether it is for the amyotrophic lateral sclerosis, and whether it is for the Parkinson disease. What do you think is the possible answer? Edaravone. All the students, those who are live right now, all of you please try. सब लोग try करिए, and definite questions will be there if ever they are thinking about asking on newer drugs. Okay, तो ALS के लिए है. All of you have got this. Very good, excellent, all of you, excellent, perfect, right? So Edaravone is one of the drug that is approved for amyotrophic lateral sclerosis. It is having free radical scavenging property. It is having your free radical scavenging property. Because of this free radical scavenging property, they will slow down the progression of this neurodegenerative condition, amyotrophic lateral sclerosis. However, if the examiner is going to ask you drug of choice in ALS, amyotrophic lateral sclerosis, then you can use another drug, that is your Riluzole. So earlier there was only one drug, Riluzole, but now we have another one, that is your Edaravone. That was approved, I think around 17 में ही approved हुआ था. 17 में ही AIMS already has asked this question. It was asked, very recently approved, and immediately after approval, AIMS has asked this question. Okay. So Riluzole is one such drug that is inhibiting the glutamate release. Therefore, if the glutamate release is reduced, the neuroexcitotoxicity will be reduced. Apart from that, it is also one of the drug that is acting as a NMDA receptor blocker. So NMDA receptor is one of the receptor for what? Again glutamate, and also a glutamate receptor by the name of kainate. So kainate receptor blocker can also be caused by Riluzole. Okay. So one is Edaravone, that is free radical scavenging property, and Riluzole is going to reduce the neuroexcitotoxicity. Alright. So that is about your, that is something about your drug Edaravone. Okay. I hope it is clear to all of you that the correct answer that we are having here is C is the correct answer. Okay. Next question. Which of the following the 5-HT4 receptor agonists utilized in the constipation dominant IBS? First, two type of question has been asked in AIMS. I'll tell you both the type of question that has been asked, but as of now, please tell me what is the correct answer. I don't think this is also a very difficult one, right? Because this has already been asked in AIMS. Okay. So this is a quick revision for you, that stradifilin, right? Prucalopride, flibanserin, lorcaserin. Okay, please provide your answer. Following 5-HT4 receptor agonist that is utilized in the constipation dominant irritable bowel syndrome. Okay, all of you have got this correctly. Perfect, very nice. Okay, so the preparation is going quite fine. I'm very happy to see all of you are replying in the same direction. Dr. Apurva Singh, I think there is some problem in your B and E. I think you tried to type B but by mistake आपने D type कर दिया. That's absolutely fine. Correct answer is very good, prucalopride, right? So that is your prucalopride is one of the 5-HT4 agonist, right? 5-HT4 agonist. Remember, one type of question that has been asked, 5-HT4 agonist that is acting via, right, which of the following G protein, that is your GS, another question that has been asked. Okay, 5-HT4 agonist that is GS के through काम करेंगे, one question. And then what is the name of the drug? That is prucalopride. There were another drug under the 5-HT4 agonist that has been withdrawn, that cisapride, mosapride, and there was another one by the name of ticacerod. So in some countries ticacerod is also blocked, however in some banned, however in some countries they are still there, right? So they all are associated with your QT prolongation as a side effect. Because of the QT prolongation as a side effect, cisapride, mosapride is actually banned for quite some time, right? Ticacerod was the next, but ticacerod is also having black box or warning. In some countries it is also banned. Okay, now since they are going to increase the motility, they will definitely be used in the constipation dominant irritable bowel syndrome. They will be used in the constipation dominant irritable bowel syndrome. Another question that can be asked to you is about flibanserin. Can any one of you tell me what kind of drug is flibanserin? And I think I have told you by mnemonic itself, by looking at the name of the drug, flibanserin. I have told you a couple of times already. It's a newer drug that happens to be your 5-HT1A agonist, right? 5-HT1A agonist, that is your flibanserin. Can any one of you tell me what is the mechanism of action of flibanserin, guys? Right, flibanserin, it is one of the drug that फीमेल के लिबिडो को बढ़ाने वाला, राइट, फीमेल के लिबिडो को, राइट, इंक्रीज करने वाला ड्रग, दैट इज योर फ्लिबांसेरिन. फ्लिबांसेरिन फीमेल के लिबिडो को इंक्रीज करने वाला, इट विल इंक्रीज द लिबिडो ऑफ द फीमेल. सो देयरफॉर इट इज यूज्ड फॉर द हाइपोएक्टिव सेक्सुअल डिसऑर्डर इन द फीमेल. ओके, हाइपोएक्टिव सेक्सुअल डिसऑर्डर इन द हाइपोएक्टिव सेक्सुअल डिसऑर्डर इन फीमेल. सो इसका नाम ही है, बहुत आसान है, राइट, फ्लिबांसेरिन, फीमेल लिबिडो को इंक्रीज करने वाला ड्रग. नॉट अ वेरी डिफिकल्ट वन, आई होप यू कैन रिमेंबर इट, राइट, हाइपोएक्टिव सेक्सुअल डिसऑर्डर फ्लिबांसेरिन. ओके, नाउ कैन एनी वन ऑफ यू टेल मी व्हाट अबाउट लोरकार्सेरिन? व्हाट काइंड ऑफ ड्रग इज लोरकार्सेरिन? कम ऑन टेल मी, बिकॉज ये देखिए अभी आई हैव डिस्कस वन क्वेश्चन, बट अलोंग विद दिस वन क्वेश्चन आई एम डिस्कसिंग अनदर 3 drugs, right? So we are discussing what, another 3 to 4 drugs in the same question, right? So you should be knowing all these newer drugs, and definitely lourcarcerin can be asked to you, lourcarcerin, right? Because the lourcarcerin, the indication of the lourcarcerin is very rare, you can say, because not very so much drugs are available for the same indication. So what is lourcarcerin, guys? What is the mechanism of action of lourcarcerin? Yes, it is one of the anti-obesity drugs. Very good, Dr. Apurva Singh. Other students, please. For obesity, what is the mechanism of action? Definitely is for obesity. What is the mechanism of action of lourcarcerin? Anyone can tell me? It is used in the obesity. Yes, very good. It is an approved drug that is used in the obesity. Lourcarcerin. Okay. 5-HT, yes, agonist. Okay. 5-HT2, right, agonist. It is an agonist, right, agonist. 5-HT agonist, not an antagonist. Remember, it's an agonist. Lourcarcerin. Okay, lourcarcerin. ओके, सो लोरकार्सेरिन ओबेसिटी के लिए यूज करेंगे. रिमेंबर, ओबेसिटी के लिए लोरकार्सेरिन. फ्लिबांसेरिन फीमेल के लिबिडो को इंक्रीज करने वाला ड्रग. प्रुकालोप्राइड, एज आई टोल्ड यू, 5-HT4 एगोनिस्ट. ओके, एडेनोसिन, एज आई टोल्ड यू दैट इट्स वन ऑफ द एडेनोसिन A2 रिसेप्टर एंटागोनिस्ट, राइट. फ्लिबांसेरिन, आई हैव टोल्ड यू ऑलरेडी. लोरकार्सेरिन also 5-HT2C agonist, right, that is also used for the obesity. Next, Pretomenin is a newly approved agent for drug resistant tuberculosis, was launched into the market. This agent acts by, please tell me. Pretomenin is a newly approved agent for the drug resistant tuberculosis that was launched in the market. This agent act by, what is the possible, है ना? What is lost, Dr. Lourcarcerin? I think obesity के लिए आप बोलना चाह रहे हैं. I think you are telling the mnemonic, Dr. Ismail. Dr. Ismail, I think you are telling the mnemonic. So one of the another drug that is present in the same family, right, that is by the name of your delamanid. Okay, so there is another drug that is from the same family by the name of your delamanid. Okay, delamanid, pretomanid. Now how to remember this? Very easy, right? Very easy. How to remember? They all are having manid, multiple M, right? Delamanid, pretomanid. Okay, so how are they going to work? How are they going to work? So delamanid, pretomanid. So they are the mycolic acid synthesis inhibitors. Okay, mycolic acid synthesis inhibitor, delamanid and pretomanid. ATP synthase inhibitor. This will be done by your beta-quilin, right? Beta-quilin. So this is not a very difficult one. Beta-quilin. Right, remember B for beta-quilin, A for ATP, B and A, ATP synthesis. Now what kind of question can be asked to you? Beta-quilin and delamanid, they are used actually in either the MDR-TB, right, or XDR-TB. MDR-TB, XDR-TB, right. Apart from that, remember, in the MDR-TB, this beta-quilin is only used in the intensive phase. In the intensive phase of 6 months only. In the intensive phase only it is used for the first 6 months only. It is not used throughout the therapy. So examiner can give you in the option that beta-quilin is one such agent that is used throughout the therapy, or you can say throughout the duration of the tuberculosis treatment. It is not. Okay, now one of the very short term regimen that we are having is your B-Pol regimen, right? B-Pol regimen that is given for a duration of 6 months, right? That is having your beta-quilin. I'm sure all of you guys have heard about B-Pol a couple of times already. P, that will be your pretomanid. So both the drugs, see, both the drugs are used. Now the problem is that both of them are associated with the side effect, that is your QT prolongation. Both of them, delamanid, pretomanid also, and also beta-quilin. Therefore, you should be giving this drug only if the patient is under close observation. Let's say in the hospitalized MDR-TB, usme denge, so that you can, right, closely monitor the patient. L stand for your linezolid. Okay, linezolid. Okay. So this will be your B-Pol regimen. That is one of the short regimen, short therapy regimen for the MDR tuberculosis. Okay, RNA polymerase inhibition is actually RNA polymerase inhibition drug that we are having here, right? That is your DNA dependent RNA polymerase. This drug is known as your rifampicin. I'm sure all of you guys remember that, right? There are many drugs against mycolic acid synthesis, right? Mycolic acid synthesis. Okay, I think option A and D are almost same. Mycolic acid synthesis of MTB, mycolic acid synthesis of MTB. Okay, so it acts by inhibiting the mycolic acid synthesis of MTB. A and D both are same. By mistake आ गया है वो, ठीक है? Both, either of them can be the answer. Okay, I hope all of you guys are clear that this kind of question can be asked to you, but do not make any mistake. Side effect, QT prolongation, remember. Okay, omadacycline is a recently approved agent that is used for. Please provide your answer. Omadacycline. Let me see how many of you can get this. Omadacycline is a recently approved agent that is used for which of the following? All of you. The options are respiratory infection, acne, abdominal infection, or it is used for the burns, right? I'm using another system just to check your answers here. Omadacycline, right? One thing is very sure that omadacycline, guys, it's one of the tetracycline. They are cycline, right? Tetracycline. So at least know about omadacycline. Few more I'll tell you. Apart from that, I also tell you to remember about glycyl cycline by the name of TGS cycline. Okay, TGS cycline, CYCLIN, TGS cycline. That is also one of the newer analog of minocycline. It's one of the analog of the minocycline. Okay, analog of minocycline. So you should know about TGS cycline. Please do remember TGS cycline, very, very important drugs. Okay, because it can be used for the MRSA, yes. It can be used even for the VRSA, vancomycin resistant staph aureus, right? MDR, multi-drug resistant strep pneumoniae, multi-drug resistant strep pneumoniae, उसमें भी आप इनको use कर सकते हैं, right? Tigecycline. Okay. What you should know is that they are eliminated also through the bile, therefore they are safer in the eliminated through bile, therefore they are safer in the renal failure patient. Another very important, safer in renal failure patients. Same as your doxy, safer in renal failure patients. In renal failure patient it is safer relatively. Okay, now the question that is asked is about omadacycline. So omadacycline is one such drug, guys, that is used for the respiratory infection. In fact, it is also used at some places in the COVID as well. So COVID में use कर रहे हो omadacycline, not तो definitely can be asked, right, for the respiratory infection omadacycline. Okay, now newer tetracycline that can be that is approved for the acne, newer tetracycline that is approved for acne is known as sarecycline. Okay, SARE, right, sarecycline, right. So respiratory infection, abdominal infection के कौन से यूज कर सकते हैं? That can be your Edaravone, है ना, Edaravone, Edaravone. So these are the three important tetracycline that is approved recently. Omada respiratory infection, acne sarecycline, okay, and then abdominal infection के लिए Edaravone, okay, enteric infection, abdomen is enteric, Edaravone, okay, acne sarecycline, okay, respiratory omadacycline. I hope it is clear to all of you, and you will not be making any further mistake if a question on this newer tetracycline, if it is going to be asked. I hope all of you guys are aware about that. Okay, so most of you have marked B as an answer for this, right? But that's not the correct answer, right? Okay, so I think I have typed this here as well. So sarecycline, as it is mentioned here already, guys, sarecycline is used for the acne, right? Irava enteric, so intra-abdominal infection, right? Omadacycline, that is for the respiratory infection. Omada for the respiratory infection. Okay. Okay, which of the following anti-epileptic drug that is acting by the CRMP protein inhibition? I think that is not a very difficult one, but definitely, right, CRMP protein inhibition, right, because CRMP causes neuroexcitotoxicity. Please provide your answer, guys, for this question. Which of the following drug that is going to act by CRMP protein inhibition? Possible answer, please, for this question. Faster. Rufinamide, safinamide, lacosamide, chlorpropamide. CRMP protein inhibition, that is one of the anti-epileptic drug acting by CRMP. I think if ever you have attended any of my anti-epileptic classes, I have discussed this a couple of times already. Dr. Anshul has started, answer has started to pop in already. All of Anshul is in favor of C, Dr. Apurva Singh is in favor of A, rufinamide, very good. All of you please try. There are many students, those are live right now. All of you please try. Okay. Dr. Grishma is in favor of B, safinamide, very good, very good. Dr. Agasti is in favor of lacosamide, very good. Okay, so I think this much information is good enough for us to start, because time come hai, discussion jada. Okay, so anti-epileptic drug that is acting by CRMP protein inhibitor. Let me just come direct to the point, right? CRMP, guys, CRMP actually, CRMP, collapsing response mediated protein. What is CRMP? That is your collapsing response mediated protein. This CRMP actually is going to activate your, right, CRMP is actually it is going to activate, it is going to cause your neuroexcitotoxicity. It is causing your neuroexcitotoxicity, right, by releasing your BDNF, that is your BDNF. Okay, so BDNF is going to brain derived neurotropic factor. It is going to cause what? Neuroexcitotoxicity. Like glutamate was also causing the same excessive neuroexcitotoxicity. CRMP is an additional one, right? So if you are going to inhibit the CRMP by the name of the drug, that is lacosamide, right, then your neuroexcitotoxicity will be reduced. Okay, lacosamide, remember, is one such drug that is also having voltage gated sodium channel blocking property. Voltage gated sodium channel blocking property, agreed, plus it is also having CRMP protein inhibiting property. It's one of the CRMP protein inhibiting. Okay, lacosamide, approved drug for partial seizure or focal seizure. Right, for partial seizure or for focal seizure you can use. For some of you who marked rufinamide as an answer, boys and girls, rufinamide, remember, it's one of the mGlu5 receptor antagonists. What is mGlu5? mGlu5 is also one of the receptor of what? Glutamate only. It is also one of the receptor of the glutamate, remember. Okay, mGlu5. All right. This is one of the inotropic receptor of the, this is active as one of the inotropic receptor, because other receptor that we are having like NMDA and AMPA, they are actually your, they are actually your NMDA, this is actually your G protein coupled receptor. They are mainly your G protein coupled receptor. They were your NMDA, this is your mainly G protein coupled receptor, mainly acting by G protein coupled receptor, mGlu5 receptor. So remember, mGlu5, 5 is rufinamide, 5, rufinamide. Okay, safinamide is not the one. Safinamide is actually your, guys, It is your MAO-B inhibitor. Safinamide is actually your MAO-B inhibitor that is used in the Parkinson's disease. I hope it is clear to all of you, right? Chlorpropamide तो यार ये तो है, ये तो हो ही नहीं सकता ना. Just the name sounds like, right? Chlorpropamide is the first generation sulfonyl ureas, है ना? It is the first generation sulfonyl ureas that we usually discuss, that is associated with disulfiram like reaction. Okay, हमेशा मैं पढ़ाता हूँ इसको, right? Associated with your disulfiram like reaction, associated with the disulfiram like reaction, that is your chlorpropamide. I hope it is clear to all of you that these are the, so what we discuss here, not only one drug. What we discuss 4 different drugs, right? Each of them, rufinamide, M-glut5, rufina5, right? Plus it is having additional property that it is also voltage gated sodium channel blocker. So voltage gated sodium channel blocker, definitely glutamate release will be reduced, and also receptor is also blocked. What is M-glut5? It's the M-glut5 receptor of the glutamate. It is one of the receptor of the glutamate. Okay. Lacosamide, definitely I told you, MAO-B inhibitor, that is safinamide, that is given, MAO-B is given for the off phase of the on-off phenomena. MAO-B is given for off phase of the on-off phenomena. Okay, I think we can go to the next question. Okay, so that was the last question, I guess. That was the last question, and even the time is not permitting to proceed further, right? And for the NEET PG students, remember, you can use, those who are going to appear for the NEET PG 2022, you can use this every day. There is a 9 PM, there is a quiz, so 20 questions will be there. That is absolutely free of cost at the app. You can avail this, right? For the NEET PG 2021, you can also avail every day at 8 PM. So 2021 at 8 PM, right, and 2022 at the 9 PM. 20 MCQ series, that is a free test that is being conducted every day. Okay, link is already given. You can download the app simply by going to the Play Store. You can type this Unacademy Learning app, right? Choose the NEET PG because you are going to be into the NEET PG segment, and after going to the NEET PG, simply sign in and you can find out a lot of courses, right? Lot of courses that is running, especially for the NEET PG, INI-CET, FMG, right? You can choose whether you want a plus subscription or whether you want Iconic. Iconic is a combination of both Unacademy and Prep Ladder, both. Okay, right, both of them. Okay, and you can use the code that I have given you. What is the code that I have given you? That is Siraj Ahmad 9, right? AHMAD, Siraj Ahmad 9 is this is together. Okay, or you can even use this code. So this code is also working, Dr. Siraj-YT or Siraj Ahmad 9, right? So do not forget to use this code to avail the discount. Okay, ACE-FMG December 2022 batch, 2020 batch is already on go, right? So most of the classes are done already. I think we are about to finish, but at any point of time, if you guys are a part of this, definitely you can watch it out, right? And for more updates and more classes at Unacademy, there are a lot of classes that are coming free, lot of revision classes that are coming free, and a lot of classes that is for the plus students as well. Okay, so at any point of time, if you feel like, definitely you can attend the classes and revise yourself, right? So I wish you all the very best for your upcoming examination, and definitely I'll be coming more frequently for the more classes like this, right? I hope you guys learned something new. Thank you very much for your presence and attendance, and as long as this pharmacology problem is concerned, once again let me tell you, let me have the problems of pharmacology, let me take care of the pharmacology. Whatever problem you guys are facing, just drop a message, right? I'll definitely be there for you. As long as I see the message, definitely your problem will be sorted. Okay, so that will be all from my side in this session, right? I'll see you guys. Take a very good care of yourself. Have a good night to all of you.